Okay, look, I know what you're thinking. Where's my watch? Okay, I took it off when I was changing, and oh, these? These are fake breasts. See, last month my mother said to me, "Hey Steph, you should do a video on self-exam for the breasts, you know?" And I said, "Ma, don't ever say breasts in front of me again. And stop always being right." Since then, a friend told me she found a lump in her breast doing a self-exam in the shower. And then Breast Cancer Awareness Month rolls around. So here I am, flashing the masses to take you through a breast self-examination you can do in the privacy of your own home and not with thousands of people watching like I'm about to. First off, if you're not familiar with your breast by now, you gotta be. However old you are, start getting to know them now. Otherwise, you don't know if something's new or if it's been there since birth. I'm guilty of this too. I'm so oblivious sometimes. My doc would be like, "You know you got a full-grown tail dragon behind you?" And I'd be like, "What color?" These are important things to know, okay? Because breast cancer kills more women around the world than any other cancer out there. And I know people both personally and professionally that have done an exam like this and was able to follow up with their healthcare provider and identify cancer early on, which may have or did save their life. So start being your own hero here and maybe save your own life. Be sure to share this with friends, colleagues, loved ones, or anyone, and maybe save theirs. How awesome is that? Real quick, let's cover some of the day-to-day things you can do that are said to help lower your risk of developing breast cancer. Number 1, be active and eat healthy. This will help you maintain a good weight. That is very important. Number 2, drinks and stinks. I mean alcohol and cigarettes, okay? We got a no-no going with those two. They're toxins. They're bad for your body, and we're starting to care about our bodies and the things we put into it, right? Try to stay out of polluted areas and avoid exposure to radiation unless it's necessary. Then last but not least is breastfeeding. Go figure. And not only are they thinking breastfeeding can help prevent breast cancer, the longer you breastfeed, the more protection you're getting out of it. And on that topic, if you are breastfeeding, you absolutely can do self-exams. Your breasts are going to be a lot different than before you got pregnant. And you may feel more lumps that might come and go, that might be normal. But if a lump is persistent, it warrants further evaluation. So if you have any concern during your self-exam, consult with your healthcare provider. Okay, so how often are we checking our breasts? We check our outfits in the mirror every day. Okay, we check the expiration dates on our milk. Shoot, the average American is checking their phone every 12 minutes. Now granted, we do want to look good for our jobs, we don't want stomach aches from sour milk, and God forbid we miss Kelly's Facebook memory of taking a selfie from 5 years ago, okay? I'm just playing, Kelly. It was a good selfie. Duckface was in back then. Don't let him bring you down. How often are we checking our breasts? Honestly. So if you're watching this on your phone, great. If not, put me on your phone, prop me up against the mirror so we can go through this together and you can start doing these periodically on your own. Now to be clear, the self-examination is not a substitute for any other diagnostic study or exam done by a trained professional, but it's a start, at the very least, to get you familiar with your breast, which is what we want to do. If you're already having breast pain, nipple tenderness, or discharge with no other explanation, or any apparent changes you've noticed in your breasts, you should have an appointment with your healthcare provider scheduled already. So if you don't, make one happen. But again, this is a demonstration of a breast self-examination based on my research from several credible sources and compiled into a succinct and effective method. Let's begin. You're gonna start by looking in the mirror with your arms down like so. Okay, look at your breasts thoroughly. What you're looking for is irregularity. And if you come across any during this exam, descriptively write them down. This is for your healthcare provider and for you to keep track of any changes that might be occurring in the future. And when I say irregularities, I don't mean that you got one inverted nipple and it's always been that way. What you're looking for is irregularities and inconsistencies with how your breasts have always been. So when we examine them, we're looking for changes. Any new dimpling anywhere on the breast, which might look like little dents? New dimples on your breast? Not good. Mark it down. Look at the texture and the pigmentation of the skin all around. Turn to each side. Anything look different? Now raise your hands over your head like you got 2 questions for me, okay? 1, where did I get the fake breast? And 2, why am I so comfortable wearing them? And the answers are simply Amazon and I don't know. I'm still trying to figure that one out myself. Alright, if you have large enough breasts where you can't see underneath, use your other hand to lift the breast up and examine the underside. Front and side views, okay? Dimples, colors, texture. Repeat for the opposite breast. Now face the mirror again to get hands on. An option to use something like baby oil might help in both seeing and feeling for irregularities. Lots of women perform the self-exams in the shower, okay? It's a convenient place, it's private, and that soapy water kind of acts like the oil would. It's also widely recommended to do the hands-on part of the exam lying on your back, sometimes with a pillow underneath your shoulder to prop you up, because it'll make your breast flatter and easier to feel for irregularities. For the purpose of this demonstration, I'm going to remain standing and without oil. It's not funny. It's not. But the instructions are the same in the shower, in front of the mirror, or lying down. Once again, raise your arm above your head. And with the opposite hand, take 3 fingers together for a larger surface area than just one. Use the flat surface at the end of them to press into the breast, starting at the bend of the arm. Pretty high up, right? Well, the breast tissue can extend all the way up to the armpit. And what we're gonna do is move up and down the breast, and in each area, use small circular motions. Now, in terms of pressure, it's suggested not too much, not too little. How vague is that? We're gonna use a clearer and more thorough approach. First, we're gonna go gently, then with moderate pressure, then finally deeper into the breast. When we're done with that section, we move on, all the way up to the clavicle, okay? This bone right here. Now remember, you do have a rib cage underneath these breasts, okay? So keep that in mind as you may feel that. However, if you feel any lumps or nodules, which can be firm and feel kind of attached underneath, lots of people say they can feel like a pebble or a bean or a kernel of corn. Write it down. Also remember, the breast tissue ain't like the silicone stuff I got on here. It's got its own feel, which honestly can feel inconsistent all throughout. So if you're moving along and you're thinking, wait a minute, I feel something. Okay, get into another position and see if it's still there. A mass or a lump will likely still be palpable as it was when you first noticed it. Also note any swelling, especially in the area under the arm, okay, where you got lymph nodes. Swelling, hardening, or tenderness should be reported to your healthcare provider. Repeat this until you've examined the entirety of the breast. And then we're gonna do a once around the breast, starting at the armpit and rounding back underneath. After that, we're going to press into and around the nipple from different angles, noting any discharge, lumps, raised areas, or any other changes in the skin. Hey, some of this may be normal, but some of it may not. So it's important to clear it with your healthcare provider. Once covered, repeat this process on the other side. And just like that, bada bing, bada boobs, we're done. Yay! But when should you be doing these exams, and how often should you be doing it? Most sources suggest to check once a month when you're least sensitive, which I'm told is typically 1 week out from the start of your menstrual cycle. But everyone's body's different, so I'll leave that up to you to figure out, okay? And if you don't get your periods, just pick a day every month. And as far as remembering these self-exams, remind me to do a breast self-examination once every month.
Okay, I've created a recurring reminder.
And that's how you're not gonna forget to do it. But what about us fellas, okay? We got breasts too, right? We can even lactate, ladies. Did you know that? We got the tissue, milk ducts, and hormones for it at least. But breast cancer-wise, a lot less likely than women, okay? And more than 9 out of 10 times, it's found at an early stage of breast cancer. It commonly presents as a hard mass right below the areola. But as always, just because you hear the words less likely does not mean you don't have to bother, okay? Everybody's body is different, and we're all responsible for our own. So I don't care if someone tells you not to bother or worry about it. Advocate for yourself, because I wouldn't have some people still in my life if they didn't. That's it from me today. I'm knocking it, clocking out. Keep sagging on me.